Wendy, I told you, do not trust atoms, okay? Why? Because they make up absolutely everything. Oh, hi. How's it going? Good to see you again. My name is Oliver, or Ollie. I'll be your physiotherapist for today. Come on in, don't be shy. Get comfortable, have a seat. Thank you for filling out your patient form today. It says here that you are here for your remedial massage assessment. Is that right? Okay. And from what I gather, you've been experiencing quite a lot of discomfort in a few body areas, mostly the neck, shoulders, and lower back region, but almost everywhere, it sounds like. Very unfortunate to hear. But you're definitely in the right place. Like I said, I will be your physiotherapist, and I have been one for almost a decade of clinical experience under my belt, working in neurological rehabilitation centers, working with kids, older adults, and in this case, musculoskeletal conditions, which I think is what we may be dealing with today. Yeah, dealing with the muscles and skeletal type structures, soft tissues. That's right. So I have to ask, is this your first time receiving a remedial massage treatment and assessment today? Okay. Well, that's fine. It is slightly different to a therapeutic massage session, whereby we focus more on a clinical goal. We want to try and find out really what's causing your discomfort and the source of your symptoms. So what that entails is a quick assessment of some of your muscles and movements and some of those structures that might be causing you discomfort. But that's not to say there will be a therapeutic and relaxing portion today with our massage. So, yeah, something to look forward to. As you mentioned, you have some neck and lower back symptoms. I just had a few safety questions I'd like to clear before we proceed any further. Now, can you tell me if you've been feeling any discomfort in or more dizziness symptoms with your neck? Okay, and just let me know if yes or no is fine. Okay, so have you been experiencing any slurred speech or difficulty speaking? And no difficulty swallowing or eating food? Okay. And how about any episodes of fainting or drop attacks, as they're sometimes known as? Okay. And lastly, you haven't been experiencing any double vision? No double vision. Okay. Good. And in regards to your lower back, you haven't been feeling any pins and needles or numbness in your saddle region or your sitting bone area? And how about any sudden or uncontrollable loss in your legs? Hopefully they haven't given way on you suddenly or collapsed recently. Okay, that's good. And lastly, it's a bit of a personal, funny question, but you haven't been experiencing any bladder or bowel loss recently? Okay. So, well, thank you. I appreciate you answering all those questions for me. Fortunately, you don't have any of those symptoms, so that is a good sign, where we just like to check for these types of things in case there might be something else sinister or something else at play contributing to your symptoms. But we're all clear on that front, which is a great start. So what I might do is just wash my hands, get them nice and clean, and I would love if you could just take a seat where you are. This is our plinth, our physio plinth, but we'll get you on here in a moment. But for now, I love if you could just take a seat where you are and bear with me while I wash my hands. Okay. Okay, so what we're going to do today is go through a few movements for your sore areas and joints. We'll also do a quick strength check for some of those muscles, and we're also going to have a feel. I'll, like I said, get you on here very soon to feel for some of those sore areas and muscles in your back, shoulder, neck, etc. So, to start with, just with your neck, I'd love for you to try and turn this way for me, like so. Good. Okay. Alright, and then this way, like so. Okay. Just hold that position for me. Just get a quick measurement on that one. Okay. Nice. Alright, that's good. And then just on the other side for me. Yeah, this way. Good. Okay. Good. One last measurement to be doubly sure. Always like to check twice. Okay. Just write that one down. Any discomfort doing that movement? Okay. No tightness. Then, let's move on and try looking up towards the ceiling for me. Just, up towards the ceiling. Very good. Okay, hold that position. Any discomfort there? No? Okay, that's good. And then bringing your chin towards your chest. Okay, just looking underneath. That's good. Okay. Alright, all those movements are within our normal ranges so far. Off to a good start. Now, I just want to check your strength. Can you try, again, turning your head this direction, like so? Alright, and just resist me. Meet me, don't beat me. Okay, meet my pressure. That's it. Good. And then this way, turning your head, like so. Meet my pressure. Don't beat me. And relax. And again, that direction. Meet my pressure. Good, good, good. And relax. And this side. And relax. Just looking up for me. That's it. And meet my pressure. Good, good. And relaxing. One more time. Looking up. Meet my pressure. Don't beat me. Good. Okay, and then chin to chest for me, looking down at the floor. Good. Meet my pressure. Meet my pressure. Okay. One more time. Down to the floor. Meet my pressure. Meet me. Don't beat me. And relax. Okay. Very good. Any symptoms with those movements? remove that. Good to know. So no pain or discomfort. Alright. Then what we might do is have a lay down on our plinth here, facing up. We just got new pillows, so I hope you like memory foam. But yeah, you can have your top on, that's fine, whatever makes you feel most comfortable. Yeah, just have a lie down on the plinth and we'll have a feel of a few movements. Okay. Yeah, where you are is fine. Okay. Now, looking at your legs, I want you to try lifting them up to the ceiling, like so. We're just going to use our goniometer here, just a fancy measuring device. But yeah, physio bread and butter. So lifting your left leg up towards the ceiling, like so, as high as you can. Okay. Hold on a second, I'll just get this calibrated and go. Towards the ceiling there. Very good. And slowly lowering that one. And let's try this side now. Hold on a second and yeah, go for it. Lifting your leg up. Good. And relaxing there. Okay, yeah, lower that one. Alright, now just with your knee, can you try bringing your left knee up towards your chest for me? Feel free to use your hands to cradle that one closer towards your chest. But yeah, I want you to really get as far up towards your chest as possible with this left knee. Yeah, that's good. Do you feel any tension or tightness or discomfort in maybe the buttock area? Yeah, okay, so a bit of tension there. Let's relax that one. Help you pop that down. What about on this side? Can you show me on this right side? That's it, bringing your knee up towards your head. Okay, good. How does that feel? Similar in terms of tightness? Yeah, in the buttock or bottom area. Yeah. Okay, some of those muscles we could probably work on, but let's try now moving onto our stomach. So yeah, I'll just move that pillow for you. Yeah. There's a little breathing face hole there. Just get yourself comfortable in there and we'll just have a feel in your back area now. Okay? Alright. Good. Now, I just have a feel through here. So, just into those back muscles there. Let's see. Having what we call a palpation. Just feeling into your upper trap region. So, yeah, a bit of tension in that exact spot there. Okay. What about on the other side? In through there. Okay. Similar sensation. Okay. And just working our way down your vertebra. There we are, down into our lumbar or lower back region. Just coming off to the sides. Now, if I rub my thumb in there, how's that feel? Bit of tenderness. Okay. Yeah. Okay. And then just off to the side again, slightly different muscle. How's that one? Okay. Let's see. And just trying that on the other side. So off to the side of the vertebrae. Pressing in there. Similar feeling. Gotcha. And then just off to the side. Okay. That's also feeling sore. Okay. Alright, so a few problem muscles already identified there. But this is a good thing. very common areas of soreness. I forgot to ask you earlier, but have you by any chance been going to the gym a lot recently, doing a lot of heavy weights perhaps, or maybe even sitting for long periods, whether you're working from home, working on a big project, or late night gaming? Okay. Bit of column A, bit of column B, ringing true. Gotcha. Because I was going to say, these kinds of muscles that we've identified as being sore, very commonly affected in maybe heavy activity or repetitive activity, almost like if they're overloaded or a bit strained from either too little rest or too much work, or being in the same prolonged posture and position. All of this can sort of build up and cause a bit of strain and overload in the tissues and in the muscles. So what I might do, I've got a little diagram I'd love to show you, so feel free to turn around and have a look. I'll just grab it now. So here's my handy dandy hand. Here is our muscles of the back, as you can see, and what I'd like to draw attention to today is this muscle here, or your trapezius muscle. So it's a very big muscle that goes all the way up from the base of your neck, or attaches in here. It also attaches down in the bottom here. So you may have heard me talk about your upper trapezius or upper fibers. That's these areas here. Hopefully that makes sense up here. And then you've got your lower fibers down here and your mid or middle fibers here. So it's quite a big muscle, trapezius, trapezoid shaped. That's in the name. But yeah, this upper trap area right there is causing you quite a lot of grief. The other area of soreness that we found was, I'll just hop on this side, this muscle right here. You can hopefully see that outline there. It's not fully visible, but it looks kind of like just parallel to your spinal column there, right in there. This is your erector spinae musculature. Very important for your posture, and it runs parallel to the spine all the way up here and down here, just parallel to your spine. Some of the other muscles are covering it at the moment. It sits quite deep or underneath some of these other exposed muscles. But yeah, it's a very important muscle for your posture, and as you can imagine, can get quite sore, particularly if we're carrying a lot of tension throughout the day, throughout your activities in life. So yeah, I can send that to you, that's no problem. I think it's a good resource to just understand a bit more about your anatomy and what's at play. But in any case, let's do a bit of massage for those sore muscles. Okay, I'll just get my hands warm. I have been known to have quite cold hands. I don't want to shock your system, but just for me turning around onto your front once again, and in the face hold. I hope that angle's okay for your head there. Okay, yeah, try to get nice and comfortable, try to relax, take a deep breath, breathe out, and we'll work on loosening up these muscles, starting with your low back here. Okay, alright, here we go. Just work on loosening up some of these muscles to begin with. it's really good to try and let them calm down, get used to touch to begin with when we do our massage. Trying to bring all of that blood full of nutrients up to the top layers and into the muscle. All of the healing properties and good nutrients required for healing and pain relief. Okay. Alright, just gently working in those sore and tender muscles. Like we said, that erector spinae muscle goes all the way up, parallel to the spine there. And how's that pressure so far? Good. You let me know if you prefer a firmer massage or if it is too much. We want a little bit of discomfort, but a little bit of pain is okay as long as it is tolerable. Some people even say it feels quite relaxing, or it's a good type of pain. Yeah, it's very common. Yeah, people say it hurts, but it feels good. We call this productive pain. It actually has a name, yes, productive pain. So, yeah, that's fine. Happy with that. Alright. Now, just getting in there with the palm of my hand. Yeah, right in there. How's that pressure going so far? Not too firm, just right. That's good. Alright, just working our way up into those upper trap muscle fibers there. Those, tight ones where we could pinch earlier. Just working on them. Alright. Yeah, sometimes people ask us that. Yeah, do our hands ever get sore? But they used to when I was a student, almost 10 years ago now. But your hands, they adapt, they get stronger. Yeah. And you learn the correct and ergonomic technique for how to do these, which helps a lot. I appreciate your concern. It's very kind of you. You must be a very empathetic person. Okay. Now, I think if it's okay with you, we might try using our elbows just for a little bit of extra pressure in that lower back area. So, right in there. Just a gentle glide to start with, but again, let me know if it's too sore. you start to feel a little bit of, a bit too much discomfort. That's good. That's it. Just working in those areas. Good. And the other side. Give that a little break. Alrighty. And you mentioned there was a bit of tightness in through the bottom area, bringing your knee up towards your chest. We'll just do a little bit on the top of the glutes area. Just on top here, just through the clothes, if that's okay with you. Just in there. That's it. And the other side. Very good. All right. Now, I think that should do us there. We'll have a quick look at some of those movements once again, but that should be feeling a bit nicer when you start to move again. Before you get up though, can you try bringing your knee up towards your chest again? Let's compare to earlier. That's it, knee up towards chest, just like that. How's that feeling? Good, much lighter, a lot looser. Exactly what we want. Alright, let's try the other side. So bringing that knee up towards your chest there, good. And also feeling a bit looser, that's good. It should feel like maybe less resistance. Okay, that's good. And then let's try now with the neck movements. Just slowly hopping up. Just make sure you don't get up too quickly. We don't want to get a blood rush to the head or feel a bit dizzy. So take your time. I'll just get my measuring tape. Okay, now just checking the measurements. We got about 21 centimeters for those rotation movements with your neck earlier. Let's see if there's any changes there. Starting with this direction, like so. Good. Okay. Much better. That's good. That's improved by 2.5 centimeters. Let's try the other side, like so. Alright. Excellent. Not as good, but still 1.5 centimeter improvement. So almost an inch going that way, about half an inch going that way. So good to see improvement. It should hopefully feel like there's less resistance, less tightness going on in those areas. Does that ring true? Good to hear. Alright, and the last one, you didn't have troubles with this earlier, which was the chin to chest. You were fine with, but I just want to double check looking up to the ceiling for me. All the way. Okay. And that one is slightly better, about just half a centimeter. Nothing significant, to be honest, but good to see. I know it was mainly the rotation that was a bit stiff and limited, but everything else seems to be subjectively feel better. If you had to rate the pain on 0 to 10 scale, how would you rate the pain right now, just as you're sitting? Okay, this is good. We call this visual analog score, or VAS. Yeah, it's just a way we can measure pain over time, and is a useful tool for us to keep track of. So I'll make a note of that one. And that concludes our remedial massage therapy session today. Hopefully you're feeling a little bit better, a little bit looser. But I'd love to see you again for maybe a exercise session to hopefully get you feeling a bit more confident and pushing you to that self-management pathway. Yeah, physios, I want you to love us and leave us in the sense that you come here, feel better, but don't feel like you need to rely on us. We want to teach you the strategies and things you can do to help self-manage and build that capacity and confidence to live your life. Yeah, something that you can do independently and manage on your own, essentially. So, yeah, I'd love to do another appointment with you sometime soon. But, yeah, that's all we have time for today. Thanks again for coming in and for your open mind and patience with me today. But take care and hope you enjoy the rest of your evening. Bye. Thank you to my awesome patrons, Andres Orlan Vasquez, James, Astor, Scott Walker, Kirsten, Josh, Patrick, Gabriel C., Will Hume, Emma, Here's Mikey, Chad Moore, James P.,